In the first study that I researched, there was about 50,000 participants who were given free access to outdoor activities, class activities, and group activities. The study focused on a variety of age groups and focused mainly on the link between physical activity and overall well-being. Researchers found that any form of physical activity was absolutely a way to reduce any depressive symptoms and anxiety as well. They claim that physical activity can be as effective or even more effective as any type of psychotherapy or even medication. The second study that I researched focused on older adults that lived in a community-based setting. They were not active, but there was no clinical diagnosis to these adults. The researchers' method to this study was something called a green prescription. A green prescription was a primary care physical activity scripting program. This was something that the individuals would take and follow throughout their daily lives. The three main aspects that were measured in the program was depression, mental health, and physical activity. Each one of these was measured at a 3-month mark and a 12-month mark in order to show progression. Each group of participants showed progression in all three aspects. They showed non-depressive symptoms and improved mental health. The final study that I researched was a study that focused mainly on college students. They sent out a survey to each student and asked a question regarding how they dealt with stress. It was an open-ended format question where the students could write in any kind of answer that fit best with them. The response rate was about 91%. There was about 368 students included in the survey that was sent out. Out of the 91% of students who responded to the question that was sent out, almost all of them came back with some sort of physical activity. There were some limitations that followed each study. In the first study that I focused on, one limitation that I found was that there was no specific age group. In the second study that I researched, there was a couple of limitations that I found. One being that it was a very small study, so the variety of results was pretty low, although they came back to back up my presentation. Another limitation was that not all of the participants were diagnosed with depression or some form of anxiety. The third study that I talked about was the one that I found the most limitations with. One of them being that it was also a small study. Only about 368 students were sent a survey. Another limitation was that only about 91% of these students responded to the question that they were sent. 100% could have given more accurate results. Another limitation was that this study was only sent to pharmaceutical students. The results could have varied if the survey was sent to other types of students rather than just sending them to pharmaceutical students. My recommendations go towards the professionals in that field, such as therapists, psychiatrists, and other doctors who deal with mental stress and mental illness and stuff like that. If doctors were to start prescribing exercise, a lot of patients could find it very beneficial rather than just jumping right to medicine. Another thing is that when you prescribe exercise to a patient will have it in their hands. It is something that they, will follow and something that they can take home and schedule out their days around this prescription that they were given. Giving out prescriptions of exercise can focus on each person's needs. Medication can affect everyone very differently. When it comes to scripting a program for a patient, you can pinpoint each of their limitations. If it's an older person and they have some physical limitations, if there's other types of limitations that inhibit patients from doing certain exercises, you can always fit their program around their needs. So my recommendations definitely go towards, therapists, doctors, other doctors that deal with mental illness and mental issues. I think it could be a huge step up in the right direction towards dealing with anxiety and depression, since they are so prevalent in our society today, especially in younger people.